up next with the talk, Navigating Uncertainty in Toxicology and Risk Assessment of PSF. Are we on the right path? Will be Philip Goodrum, PhD, and a diplomat of the American Board of Toxicology. He's a principal toxicologist at GSI Environmental. He is also an adjunct professor here at SUNY ESF, where he teaches environmental risk assessment and where he received his Master in Water Resources and his PhD in environmental engineering.
Thank you very much. Thank you very much. It's a pleasure to be here and to be back on campus. Last class was a couple of weeks ago. Students will know that. Our classroom was 2 floors up, actually. We were right here. This was a great setup talk. Thank you, Damien, for that, because often it's the chemists and the toxicologists that have to work hand in hand. Once we detect those chemistries, the next questions are, is that safe? At what level should we begin regulating? What are the implications of setting lower levels? And how much certainty do we have? So up comes the toxicologist who tries to answer all of those questions. The spoiler alert is we don't have all the answers to those questions. Unfortunately, there's still a lot of uncertainty. We saw the error bars on the non-targeted chemistry. Some of the error bars on the safe doses, which I'll talk about in a moment, are rather large, alarmingly so. So the challenge in the toxicology community is to reduce that uncertainty. What data sources do we need? How much can we rely on animal data versus human data? And what's the right public policy around these uncertainties? We'll hear a little bit later in this session some of the real implications of setting really, really low standards. Okay. So in the risk communication field, what we've learned is try to be clear, simple, as transparent as possible, present the uncertainties, present the balance as best you can. Okay, so there is an alphabet soup of PFAS chemistries. PFOS and PFOA kind of live on the non-polymer side. Today there's a lot of interest on the polymers, very diverse class of chemistries, and a lot to learn still. So what we're trying to do now is piggyback off of the information that we have on the known compounds, fairly well studied in terms of toxicology, and ask questions about read across. To what extent can we group into these subclasses and then make estimates in the absence of actual data, either animal data or human data? So PFOA and PFOS have been the focus for a very, very long time. They have been phased out. You can still detect them, hence the moniker forever chemicals. The forever chemical moniker is sort of a misnomer, though. Just as there's diversity in what you can detect in the wastewater samples, there's diversity in what happens once they reach the environment and when they're in our bodies. So while some chemicals hang around for a very long time, the half-life, what we think of as an environmental half-life or even a biological half-life, varies quite a bit. So the forever chemical gives us that idea that some of these compounds hang around a long time, and if that's true in your body, then there's a greater likelihood that we're going to see some impact, some effect from that. But I guess just to plant the seed, because there's a large variance in these properties, not all of them are really forever chemicals. Some of them break down fairly rapidly. Without having water quality criteria, because of the phase out, so prior to having some regulations that were just implemented by EPA on these two compounds, we can still track through national survey data what the concentrations are in people's bodies. So most of us have PFAS in our systems. They're ubiquitous, they're present in lots of different products, they're present in the environment, they're present in most water. So hence we all have some measurable level now in our bodies, so we can track that over time. So the CDC, through the National Health and Nutrition Examination Survey Program, has done just that, and what you're looking at here are two graphs of just the geometric mean plotted in the adult US population over time. Is that enough, though? So those concentrations are coming down, that's great, but there are still some known sources. So this, the focus here in this workshop is on water. Of course, there's many other sources, and water is used, for example, in agriculture, and there's lots of different ways that PFAS can transfer and become a source of exposure. So it's important to kind of understand the relative contributions of those different pathways and then try to address those. And that's exactly what EPA's mission has been. So the maximum contaminant levels that are set for protecting the drinking water exposure pathway have been set. At this point, they're at analytical detection limits. The health-based levels are actually much, much lower, and I'll show that to you in just a moment. But beyond PFOA and PFOS, you can see a few other compounds listed here. EPA is making its way systematically through compounds that have been prioritized. They've been prioritized because they can be detected. We have some toxicity information. Some of them are bioaccumulative. And then to add a fourth criteria, mobility. So when it gets in the environment, if it's something that's going to be a little bit more mobile, that's going to potentially be a greater concern. So through screening processes, we can rank order our list of targets in terms of toxicology. When we look internationally, we see actually a lot of variability. So good scientists working at different environmental agencies throughout the world are implementing their procedures, their policies, their approach to setting these criteria. The end result is we have quite a wide range. So when you look at international regulatory values, the current drinking water levels vary by orders of magnitude. I've included in here New York State, 10 parts per trillion. EPA's current MCLs are at 4 parts per trillion, and again, that's the analytical detection limit. So why? Why is there such a great inconsistency across these agencies? It's a complicated answer, and it involves lots of different things. So there's this interpretation of the science. So if we assemble all the best studies, certain studies might be viewed as being more representative than others or more informative. There's different comfort levels with uncertainty. There's different choices of effect endpoints. The regulatory program in terms of what margins of safety we introduce, so that when we're using an animal study and we're trying to predict what's going to happen in a human, we're introducing some uncertainty factors. Those can vary. And then what type of water we're talking about. Is it a drinking water source? Is it groundwater that might be used for irrigation? So we have different environmental regulations to govern different water uses. And in those different programs have evolved slightly different approaches. So while you might have information on toxicity, by the time you get to a back-calculated screening level, you can have a different number. Okay, so just a little bit in terms of, to give you a flavor of why the toxicology is not a set science, all right? So one of the important things is causation, association. Is it an adaptive response? Is it an adverse response? So on the left, we can see human studies do show that there are associations with a variety of different effect endpoints. Some of these PFAS compounds affect fatty acid metabolism, which affects cell function generally throughout the body. Because of that, we don't see just one dominant system that gets affected. There's a cascade of potentially multiple systems. So the immune system is a current focus right now. Potential cardiovascular effects may be linked to changes in homeostasis of cholesterol. So cholesterol can go up or down, but it's that ability to kind of regulate cholesterol that we're looking at. Decreases in birth weight, so a developmental effect. There's indicators of that. On the right, you look at ATSDR and other agencies, and they say, yes, but. So yes, these are indicators, but do we actually see outcomes of disease from this? So enter the epidemiologists to say, at what levels are we actually able to tease out the association between PFAS exposure and other potential risk factors? So epidemiology, pretty challenging to do that when you have very low levels. At very high levels, it's a little bit easier. Okay, so in setting a toxicity value, you have a weight of evidence. We have lots of different endpoints that we're looking at. You might select a different key study. Once you have all of those data, we're doing dose response analysis. At the end of the day, we're trying to set a low dose that might impact the community. So we set low effect levels on purpose. There are data gaps. We are used to making policy decisions in the face of data gaps, so that's not new. We can introduce uncertainty factors because of that. The exposure assumptions are not as much of a critical factor in terms of what explains the variability in these values. The elimination half-life is an important concept. It's just the idea that if we reduce exposure through one pathway, how long will it take for the blood serum levels to come down of these PFAS compounds? Those estimates vary quite a bit. Some of them come from extrapolation from animal studies. Some of them come from evaluation of epidemiological data, like I showed earlier. And they have a direct implication on the final screening level, for example, in drinking water. So it's a one-to-one relationship. Lately, there's been a focus on PFOA and whether or not the half-life in PFOA can be set at a couple of years, 1.3 years versus 2.7 years doesn't seem like a major difference, but right there's a factor of 2 difference. When we compare Health Canada and EPA in terms of how they actually develop these safe doses, what we would call a reference dose, at the end of the day, the lower the reference dose, the lower the drinking water screening level would be. So there's a 14,000-fold difference between Health Canada and EPA in 2021 because of the variety of choices that they made along the way in setting that value. More recently, EPA updated its PFOA evaluation and changed it by about a factor of 20. So even within the same agency, as the science emerges, of course, they're going to try to make some adjustments. On the non-cancer side, immunotoxicity is a huge debate right now. There's questions about the extent to which changes in titer levels might impact efficacy of vaccines and therefore later disease rates. So stay tuned for that if you're interested in how toxicology will make determinations of relative potency of PFAS chemicals. The immune system is going to be one of those. Burgoon et al. Last year tried to say, can we do better than the 3 orders of magnitude difference in those safe reference doses for PFOA? So an international panel was convened, many different scientists looking at the same studies, and came up with just around an order of magnitude variability between those groups. Cancer is another endpoint that is actually becoming more of the driver now, at least for PFOA and PFOS. The latest screening levels, EPA just on Tuesday updated its regional screening levels, which include protection for tap water and groundwater. And cancer now is starting to leapfrog non-cancer as some of the effect endpoints. There are different ways that we are estimating the properties of these compounds. I just wanted to highlight one of them that EPA is now using. It's their ETAP program, so using gene expression, transcriptomics, to help set these screening levels. So this is the idea: you can do a short-term study, you can look at exposures, changes in gene expression, and that might be an indicator of later effects. This has actually been applied, and the first compound that was out of the gate was one of the PFAS compounds. Mixtures is another challenge. There's research going on right here at ESF looking at combinations of PFOS and other contaminants in water. Mixtures right now is dealt with programmatically as the assumption is additivity. So we keep adding chemicals together, and the relative potencies give us some sort of idea on average of what's going to happen. The tox values are used in lots of different ways. This is just the last slide to show that we have, beyond water, lots of different programs where the choice of the tox value can have major implications on public policy. So thank you very much. I'm happy to take questions.
Thank you, Phil. Very interesting presentation. We could have allotted the entire session to any one of these topics. Quick question while we make a change. Len?
Yeah, you mentioned there are regional screening levels have been updated for groundwater, anything for wastewater.
No, so the regional EPA has what they call regional screening levels. Those are sort of a first pass. If your concentrations are below that, you're highly confident that there's unlikely to be any effects. When you're above that, you have to do a more rigorous risk assessment. Soil under residential and industrial commercial contact, tap water, and soil for protection of groundwater. Those are the major focus. But EPA doesn't set in the RSL tables industrial wastewater stream levels. That's a different program.